Today we will be talking about the health benefits of fruits. Actually, there are lots of good local fruits that are very nutritious, but there's not as much research on them as there are on the Western fruits. So most of what I'm covering are Western fruits. Okay? Fruits are very colorful, very attractive, they have their aroma, and they are usually very high in water content. So they are low in fat, they are also low in sodium, low in calories. So they are good for people who want to lose weight, especially if they are not the too sweet type like mangoes. Like watermelon, though it's sweet, it's actually a lot of water. Alright, so fruits and vegetables are the food groups that have the most amount of vitamins and minerals as well as phytochemicals. So they're very essential to health. That's one of the first things that God gave man to eat. And it's so convenient because you don't have to cook them. You can just wash and eat or cut and eat. Okay, so they're good for the digestive tract, and they also contain B-complex vitamins which help with their digestion also. Okay, they help to fight skin disorders and improve your hair so that you have healthy hair growth. And they also do protect against chronic degenerative diseases. Commonly you have heart disease, you have cancer, diabetes, high blood pressure, stroke, and so on. Because they have a lot of antioxidants and anti-inflammatory components that help to protect against those diseases. So they are good source of energy, easy to digest. Alright, they help with our digestion. They maintain blood pressure because they are higher in potassium and low in sodium. They help to control diabetes. Though they are sweet, diabetics should not avoid eating fruits. But we recommend that diabetics eat their fruits at breakfast. Somehow, eating the same thing at breakfast and eating at night makes a difference in terms of how many calories you absorb. So if you eat junk food in the morning, you do not get as many calories absorbed as you do when you eat it at night. Okay, and the sugar spike also goes up more at night. So we say to diabetics, don't eat your fruits at night, eat them in the morning. Okay. They help to prevent heart disease because of the fiber, because of the phytochemicals, and low sodium and so on. They prevent cancer, again, because of phytochemicals, antioxidants, anti-inflammatory contents. They can help to lose weight. If you eat them as whole food with their water content intact, we don't say that you eat dried fruits freely, okay, because dried fruits are more concentrated. But that is not to say either that you do not eat dried fruits. Dried fruits are also good. Just eat them in smaller quantities and not as often. Okay, so note that fruits are very good for your skin and for your hair. And that makes you look good, right? Okay, the skins are rich in fiber, so that also helps with bowel movement. Okay, alleviate means actually reduce gastritis or inflammation of the stomach, and constipation is not being able to move your bowel regularly. So this helps you to move your bowel regularly. Hyperlipidemia means high blood lipid. This may include cholesterol, triglyceride, LDL cholesterol. So it helps to keep them down, helps to lower your blood pressure, helps to lower obesity and diabetes. It's anti-carcinogenic, or it can help fight cancer. Okay, it helps with bowel movement. Apples, one of the best fruits to eat is apples. Okay, you can eat it every day, especially if you want to lose weight. This is very high in a lot of good phytochemicals. And there was a study done by the University of California at Davis, where they find that apples and apple juice contain antioxidants that help to fight atherosclerosis, or the formation of cholesterol plaque in the arteries. And they also reduce the bad LDL cholesterol, prevent the oxidation. Okay. Quercetin is also found in apples. It's an antioxidant and it reduces lung cancer risk. Apple components also can affect health in many different ways. Alright, apples are superior to any fruit for a standby that grows. This is from the book Counsel on Diet and Foods, page 312. There are systematic reviews and meta-analysis of 41 studies where eating apples reduce the risk of cancer in different body sites, okay, especially the lungs and the digestive tract. Lower cancer mortality means lower the death rate from dying of cancer. Quercetin is also help with fighting cancer cells from growing and multiplying, especially of the breast, the ovary, the lung, liver cells. So apples fight cancer. Apples fight heart disease. Apples are good for diabetics. They contain at least 7 types of cancer-fighting compounds. For example, flavonoids and polyphenols. Okay. These are found mainly in the skin. Now, there was a time when it was said that apples had this pesticide, I think ADA or something like that, and people say, oh, I'd rather peel off the skin of the apple before I eat it. But if you clean it well and you soak it in charcoal powder water, you can eat the skin. And the skin is very nutritious. Yes.
For how long?
15 to 20 minutes. Yeah. So I would rather eat my apples with the skin. Okay? Because most of the compounds are found in the skin. Even like grapes also, some people peel off the skin, right? And even throw away the seeds, but that's the best part. Because that's where you have more of the phytochemical that protects you. The resveratrol and the grapeseed extract. Okay? Prebiotic, so apple is a prebiotic in the sense that it feeds the good bacteria in our gut. Now when you have good amount of good bacteria in your gut, then they produce things that protect us. Short-chain fatty acids that keep our colon cells healthy, and they are very protective against colon cancer. Okay, so apples are good prebiotics. Prebiotic means it's food for the bacteria, good bacteria. Okay. Whereas your yogurt is called probiotic. It's already got the bacteria in it. Okay, these are different types of phytochemicals found in your apples. And they help to reduce inflammation. Inflammation is process or reaction of the body by which it tries to address or overcome injury or harm, toxins and things like that. Okay. So it summons the immune cells to the site to address the problem so that it doesn't become worse. All right, and usually it should resolve over time. But when we keep adding inflammatory foods into the body, then your body has to keep on fighting and keep on eliminating. It can come to where it becomes chronic and it becomes a problem and even increase disease development. So when I visited a lady at the hospice, and I was there for quite some time, from breakfast I saw what kind of food was served, and this lady was in pain as usually people in hospice are in. And the doctor came and she said, I'm in pain. Okay, he will increase the morphine, yes, the painkiller. But you know, over time that loses its effect. In my heart, I was thinking, you keep on giving inflammatory foods. One of the cardinal signs of inflammation is pain. How are you going to get rid of pain when the cause keep coming back in, keep coming back in? The food is not changed. It's a perpetual problem, you know. So we want to have food that are highly anti-inflammatory, and fruits are highly anti-inflammatory. Okay, so they help to prevent the multiplication of cancer cells. And not only that, they help to promote their destruction, cause them to be bound together or to burst apart and not be able to function anymore. Okay? They also inhibit the growth factors that are involved in cancer development. Not only, you know, cancer goes through different stages, right? You have initiation, you have promotion, and then progression. So at each of these stages, the phytochemicals can stop the process and reverse it, which is wonderful. Metastasis means spreading to another site. So it is protective of the colon and liver by reducing the inflammation there. So this study showed that those who ate an apple a day reduced their risk for breast cancer by 15%, and throat cancer by 21%, esophageal cancer 25%, colon cancer, colorectal cancer 42%. So super protective of the colon and rectum. Okay, apple sauce and apple juice. Though from the same fruit, the apple is more intact, has the most amount of fiber. Apple juice has apple juice has the least, and apple sauce is in between. So the best way to eat is actually the whole apple rather than the juice. And if you are diabetic, we do not recommend drinking fruit juice, okay? Because you don't have the fiber. What you need is mostly fiber, all right? So go for the whole thing. When you eat an apple, you may feel full. I don't think any one of us will eat 4 or 5 apples in one sitting, right? Or in one meal. But you can drink the same amount in a glass of juice and not feel full even from it. So that's how, you know, it's easy to gain weight when you refine foods. Now, berries are excellent, especially for people with cancer, with heart disease, with diabetes, with metabolic syndrome. Okay, they are super nutritious. Let's see what they have. Okay, they have bioactive properties, phenolic again, and they are antimicrobial. That means they fight microbes or microorganisms, bacteria, viruses, and so on. They are antioxidant. We'll talk about all these things in the past. You can go and review your past videos to see what all these words mean. Okay. Immunomodulatory effect means they affect our immune system so that they can have a better fighting edge. Okay. Of course, there are vitamins A, C, E, maybe not so much E, but especially C. Berries are very high in vitamin C. And the different colors have different phytochemicals. They like the purple or blueberries have anthocyanins. The red have lycopene and so on. So they support the immune system. They reduce both number and size of pre-malignant and malignant lesions. They slow down oxidative stress and aging. You want to look younger, eat more fruits and veggies. And they are anti-inflammatory, anti-cancer, lower blood pressure, lower blood sugar, okay, kill bacteria, inhibit their progression. They modulate the expression of genes and proteins involved in apoptosis. Okay, apoptosis just means cell death, or the cells that are bad, that are so to speak, burst or commit suicide, so they do not continue to do their harm, do not multiply. Okay? These are like cancer cells or cells that have been damaged or oxidized and so on. So all these are different ways by which your fruits, your berries especially, will protect against cancer. Blueberries. Nowadays, you can get them at about $2 a plummet, so it's a good time to buy. If they sell the frozen ones are very good too. In NTUC, whenever it's on offer, it's a good time to stock up.
Not the dry one, is it?
Yeah, dry is fine too. Dry is fine too.
The nutrients still inside.
Yes, yes.
Except vitamin C.
No, there's still some vitamin C in it. Okay, American Cancer Society study, nearly 100,000 people. You know, the more people they study, then the result would seem more reliable. If they do it in a good way, like randomized controlled trial. Okay, and that those who ate the most berries were less likely to die from coronary vascular disease. So they are also a guard for the liver and brain. So people who are obese, for example, or overweight, they have an inflammatory state. Obesity itself is a state of inflammation. That's why it is important for people who need to lose weight if they have excess weight. Yeah, a body is on fire, okay, and you want to fight that fire. So that's why we would recommend eating berries on a regular basis. Some people need them more than others, especially if you have metabolic syndrome, you have liver concern, non-alcoholic fatty liver disease, or liver cirrhosis and things like that, liver steatosis. Blueberries will reduce oxidative stress in athletes. Okay, when we over-exercise, like in marathon, inflammation also takes place. So you can eat these foods to help quench the fire of inflammation. Okay? The anthocyanin, the color, is blue color. That is the antioxidant in the blueberries. So it can even help you with your memory. That is not if you don't do any memorizing yourself. You have to put in the effort to memorize too. Okay? So older adults who exhibit early cognitive deterioration actually can improve in their memory by eating more blueberries, and even people with Parkinson's disease can improve with the intake of blueberries. It doubles the count of natural killer cells. This is the NK cell that fights cancer. Okay.
So blueberry should be 1 bowl or
Okay, one serving is half a cup. So one plummet is 1 cup. So 2 servings, 1 plummet. When you buy the square box is 1 cup, contains 1 cup, which is 2 servings. Okay, it reduces obesity. All right. It decreases the weight, the BMI. It can decrease glucose, cholesterol, triglyceride, and even Alzheimer's disease levels. Inhibit fat accumulation. So you have less abdominal fat. That's the more dangerous fat, the upper fat compared to the lower fat. Okay? Apple shape is worse than pear shape. Lower triglycerides. Triglycerides are the fats under your skin. Okay? Lower cholesterol, reduce inflammation, and increase this good bacteria count, which this particular good bacteria actually has anti-obesity activity. Oh, this is in your yogurt. It lowers diabetes risk. Okay, it lowers sugar. Improve fasting sugar, improve insulin sensitivity. We need insulin to carry the sugar into the cells. So if there is the cells are responsive to the insulin, then they will open up for the insulin to bring the sugar down into the cell. But a lot of people who are long-term diabetics tend to become insulin resistant. Insulin, they are not so sensitive. So though there may be enough insulin, yet if the cell door does not open up, the sugar can't go in, it stays high in the blood. Okay, so it even improves glucose tolerance. And blueberries are also good for the heart. Again, with the anthocyanin phytochemical, decrease undesirable blood clotting. When you have atherosclerosis in your blood arteries, especially your heart or your brain, cerebral blood vessels, if there is a blood clot that gets stuck in that little space where the atherosclerosis is and the blood vessel wall, then blood cannot continue to flow through. And then the cells that need the blood will die with time. Okay, that's when you get heart attack or stroke and things like that. So it helps to decrease that because that's undesirable. Of course, if you cut yourself and you're bleeding, then blood clotting is desirable, okay? This is another phytochemical found in blueberries called plerostilbene. Stilbene is a whole class of phytochemicals. So this nitric oxide that this stilbene helps to improve is what keeps our blood vessel dilated so that blood can have more space to flow through. Can protect against atherosclerosis, protect against or reduce heart attack risk. So one serving a week, you don't have to eat it every day, but at least one serving a week can reduce hypertension by 10%. One serving is half a cup. Okay. Do you know freezing the blueberries actually improve the availability of the antioxidant? So it's good to eat them frozen.
So buy the frozen one?
Yeah, you can.
Cheapest one.
Especially if they sell in the 1 kg on offer, it's worth buying. Okay, these are different mechanisms or ways by which blueberries help reduce heart disease risk. Okay, the blood vessels are not as stiff, the arterial stiffness. It's the stiff arteries that will break more easily. It reduces blood lipids, reduces oxidative stress, reduces high blood pressure. It helps with the endothelial function. Endothelium is the inner lining of the blood vessel, which is where you don't want the atherosclerosis to form, and reduces inflammation also. Strawberries, doesn't that look luscious? Okay.
The
Yes.
blueberry, when you take, like you have black stew
Black stew?
from blueberry.
I've never seen that before. However, if the stool color is due to what you eat, that's not a concern.
Okay.
I know that red dragon fruit does give you pink urine, and that's not a concern. Polyphenols and ellagic acids are anti-inflammatory. Okay, they protect your stomach epithelial cells. They also increase these bifidobacteria, good bacteria. Again, remember earlier we mentioned that this particular bacteria, it has anti-obesity activity. Okay. Strawberries are anti-cancer. They lower metabolic syndrome. So if you're overweight, you have high blood cholesterol, you have high triglyceride, you have metabolic syndrome. Okay, and this would be good to eat. Okay, lower diabetes risk. Combat neurodegeneration, that means that it helps your nerves not to degenerate so quickly. And it also kills bacteria. Cranberries. Cranberry, when it's fresh, it's quite sour. In the NTUC Finance, you can actually buy cranberry juice that is unsweetened. So if you have UTI, urinary tract infection, that is the kind to go for. Because we usually don't find the fresh ones here. And the dried ones, they tend to add sugar to it. That's why it doesn't taste sour as it would normally do. So I would recommend buying that unsweetened cranberry juice, which as far as I have found, only NTUC Finance carries it. Okay. So this one is good for treating urinary tract infection. There was a study where the participants took cranberry juice for 8 weeks, and their CRP decreased. CRP is inflammation marker. It stands for C-reactive protein. Okay, so if it's lower, that's good. That means you have less inflammation. Okay, serum insulin. You don't want to have too much insulin because hyperinsulinemia is also harmful. People who are on insulin jabs, they can kill themselves if they put too much insulin into their body. And it increases cancer risk also when the insulin is too high. Okay. So HDL is the good cholesterol, so it increases it is fine. Okay. It's also anti-diabetic, isn't that nice? Anti-obesity, I mean. Goji berries. Okay. This one is less expensive of a thing. It is high in melatonin. What's melatonin for? Yeah, help you to sleep. It's actually what is considered a hormone, rejuvenating hormone. Okay, so it has the third highest antioxidant capacity of any common dried fruit. You don't want to eat too much of it also.
So that you won't be sleepy.
Zeaxanthin is another phytochemical. It also helps with your eyesight and with preventing macular degeneration. Macular degeneration is when you don't see things clearly. It seems like there is a dark around the edges.
Is this do you trust Singapore? They sell this goji berry all pack, but every time from
China, right?
Any other place that can buy it? Other country that is not so. They say China they always add a lot of calories to make it nice. Then
Yeah, so don't buy the very nice looking one.
so they like
Not the bright red ones. Yeah, I've read that they do add some chemical to keep that color so appealing, but it's not good for us.
goji berry don't come from any other country except China, right?
As far as I know, I don't know where else.
Don't got anything from anywhere else.
Which dry will be best? I buy it all from China.
Cherries. I think you can buy cherries. This is the month that has the most variety of fruits now, especially local fruits. Okay, it's also good for fighting cancer. Also good for treating gout. Okay, it's very anti-inflammatory. So compared to some gout drugs that cost US $2,000 a dose, can you imagine? With no clear-cut distinction between non-toxic, toxic, and little doses, you might as well eat cherries with what they call heart at ease, because there isn't that harmful side effect. Though the US drug, that drug that is used for treating gout, can even have this serious rare side effect where the skin detached from the body. That was horrible, right? So cherries are anti-inflammatory, decrease oxidative stress in 810 studies, and muscle soreness and loss of strength from over-exercise can also be reduced with the intake of cherries. Blood pressure also reduced. Look at the number of studies, 8 out of 9, that is very high, very reliable, strong evidence. Okay, blood pressure, 5 out of 7 reduced their BP. Arthritis in 5 of 5. So if you have arthritis, go for cherries. Even improves sleep. So there are many food that are sleep aids. This is another one of them also. Kiwi fruit. Besides being good for, what else? For your bones. Kiwis are very good for your bones. Okay.
Green ones,
I would not recommend taking it 1 hour before bedtime. You can just eat it
eat the sour one.
in your breakfast even. Okay.
Any difference in the strength on green and yellow? I mean,
They are different.
they're different.
It's the green one that seems to help with the bone formation. But I mean, yellow is fine too. Yeah, now we're talking about the yellow ones. Okay, they reduce your flu infection, contracting flu, nearly in half, and speeds the recovery from URTI, that's upper respiratory tract infection. So good for the lungs. Flu also has to do with too much mucus, right? Infection. So it increased plasma vitamin C, vitamin E, which are antioxidants, as well as other antioxidants. Papaya. When I was in Bolivia, there was this farmer who grows papaya, and once he's harvested the season, he would not use the same plot of ground to grow papaya again. He would go and try and rent some other land to grow papaya. His papaya was so delicious, which goes to tell me that papaya is so nutritious. It sucks up so much good nutrients from the soil that it depletes the soil of the nutrients, so it must be very nutritious, right? Just like okra, ladyfinger also. You don't grow it back in the same place unless you go and fertilize it a lot. Yes.
No way of taking the seed, is it?
The seed is anti-parasitic. You have to chew it. You have to chew it. You can chew it. It's not so small that you can't chew. It's anti-parasitic. It's a bit spicy in the taste. You will not stomach too much also. Okay, so it has strong antioxidants to fight free radicals. It has lycopene, the red color, which fights cancer. Okay, it's also good for the heart, protect and good for your good cholesterol. Papain is the enzyme. Now, if you eat green papaya, it has more of the papain. So if you have digestive issue, poor digestion, then you buy the green papaya and just chew on it. Or you drink lemon juice, half a lemon, the juice from half a lemon before your meal. And if it's so bad, you may want to buy a heating pad that you can carry around your stomach area and wear it during meal time to help with your digestion. And also after meal, go for what we call a digestive walk, still wearing that thing. Okay? So if you have poor digestion, these are 3 things you can do.
How do we know poor digestion?
If you are bloated and you feel your food is not still full for a long time, and it's not moving in your digestive tract, and you probably have poor digestion. As we grow older, our digestive power does weaken.
So you have to put the thing on when you eat your food?
Yes, put it on while eating during your meals, and after the meal, go for a walk wearing it. After
It's a
your
belt.
it's like a belt that you can wear over your stomach.
That means if you are hungry easily, you got good digestion.
Not necessarily. That's a good question. Sometimes we train our body because we're so used to snacking that we train our body to expect food like cows grazing grass all day long. We'll have to reprogram ourselves. Okay, so do you know that the papaya seeds are not only good for treating parasites, but also it's good for treating ulcers. And likewise, the leaves very bitter. The leaves are very good for treating dengue fever. Yeah.
How do you use it?
You have to juice it and drink. It's super bitter, but it's very effective.
Talking of bitter leaves.
Papaya leaves.
It's true.
It's true. It's true. It does. We have worked with people using it.
Drink a bit.
Okay, it can protect the skin from damage and slow down wrinkling. Wow. So you want to look younger, eat more papaya. Pineapple. This is another fruit that has a good amount of enzyme, bromelain. Anyway, so pineapple has many nutrients, vitamin C, manganese, B vitamins, minerals, fiber. Bromelain is the enzyme. Can help fight pain, swelling, and promote tissue healing. Fight inflammation, relieve arthritic pain. Help digest food, good for strong bones. Wow, pineapple has so many benefits for our body. And even help you with post-recovery, post-workout recovery, post-exercise recovery. Watermelon. Okay, it get rid of excess ammonia, help heal wounds, support eye health because of the high vitamin A and antioxidant content. Immune system helps boost it. Relieve muscle soreness. Okay, helps to produce the nitric oxide that open up the airways. Not airways, arteries to allow more blood flow. Helps with muscle function, help with skin health, help with digestion. Okay, so lots of good things to these local fruits. Oranges and citrus. Yeah, this we recommend eating on a daily basis. There are different varieties, so you can just rotate among the varieties each day. So they are very antioxidant, protect against damage. They also are needed as part of your the structure of your skin. You know, they say the cellulose.
Cellulite.
No. What is that? Collagen. Collagen. That's right. You need vitamin C to form the collagen. Okay. It enhances iron absorption to fight anemia. So if you are anemic, then have some citrus fruits or vitamin C rich fruits, or in your salad when you eat raw, there's vitamin C there. And your salad dressing, if you use lemon juice or some of these citric acid, citric fruits, you get your vitamin C there also. So they are good for your immune system, and they also help protect your eyes from macular degeneration, age-related ones. They fight cancer. Okay, there's a natural oil in oranges that keep our skin young and fresh. By the way, the skin of the orange, you can scrape it. The zest, just the zest. It's very nice. You can throw into your salad also. And it has other phytochemical like limonene, which is useful for fighting cancer and other purposes. Flavonoids and flavones are phytochemicals that help prevent erectile dysfunction, protect brain cells from free radical damage, protect brain cells from inflammation, from Alzheimer's disease, from Parkinson's disease. Lemons are high in antioxidant, good for the heart, helps increase insulin sensitivity, good source of soluble and insoluble fiber. Also fight all these different chronic degenerative diseases, including arthritis and obesity. Prunes are good. Usually people know it for bowel movement, right? But do you know this is good for your bones too? Yeah. Yeah, it enhances bone formation, reduce bone resorption. So actually build up rather than break down. Increase bone mass density and reduce osteoporosis. Antioxidant, anti-inflammatory. Okay. So it says that just 50 to 100 grams of prunes, that is like from 5 to 12 prunes eaten a day, can significantly reduce all these things, inflammatory cytokines and so on. Pears. The humble pear. This is also another fruit good for people who have diabetes or who have obesity to eat more of. They are less sweet, they are higher in fiber. They have laxative effect. Okay? They have phytochemicals like phenols. They regulate alcohol metabolism, protect against cancer, lower plasma lipids. Plasma means in the blood. Beneficial compounds concentrated in the peels. So don't throw away the skin, eat the skin. See, anti-diabetic or anti-obesity, anti-hyperlipidemic, anti-inflammatory, anti-mutagenic, anti-carcinogenic, detoxify. Okay, xenobiotics, what does that mean? Things that are contaminants found in the things we use. Respiratory and cardioprotective effects as well as skin whitening effects. Okay, even for prevention of COVID-19. Grapes. Isaiah 65:8 says that, thus says the Lord, as the new wine is found in the cluster, this is a cluster, and one says, destroy it not, for a blessing is in it. So fresh grape juice is good for you. Not fermented, not alcoholic. As found in the cluster is not broken, right? The cluster is intact. I prefer eating grapes with seeds in it. So grapes are good for lowering all those lipids. So they are protective of the heart, and they have many other phytochemicals. Lycopene is another one.
Do you swallow the seed of the grape?
You chew it. Yeah, you chew it. If you swallow, then it come out the other end intact. Passion fruit. Okay, high in vitamin C also, besides vitamin A, potassium, magnesium, quite a number of minerals. Calcium, iron, fiber, niacin. You can make a salad dressing with passion fruit also. It's anti-inflammatory, antioxidant, help with bowel movement, improve insulin sensitivity, reduce blood pressure. Magnesium helps to reduce anxiety as well as high blood pressure. Helps with sleep also. Okay, so here are just a few quotes to end the sharing with. A fruit diet for a few days has often brought great relief to brain workers, people who are more sedentary, who don't exercise enough. Okay, more die from eating decayed fruit and decayed vegetables, which ferment in the stomach and result in blood poisoning, than we have any idea of. So do not eat decayed fruit or vegetable. Any question? I think you're hungry and
durians?
Yes, durian lovers want to know. Yeah, you can. Durians have nutrients, of course, and phytochemicals also, vitamin A. You don't want to eat too much, huh?
Sugar, right?
Yeah, it's higher in your carbohydrate in the sugar.
How about mangosteen?
Mangosteens are very good, very nutritious.
Mangoes? What mangoes?
Sure, they are. As far as I know, all those edible fruits, they all have different nutritional value. So eat a variety, and eat variety in terms of color, not only the types of fruits. But if you have certain concerns or health conditions, you might want to eat more of certain fruits like apples, pears, those that help you reduce weight and fill you up without you feeling hungry and wanting to eat more, eat between meals. Okay. Thank you. I think lunch is ready. Shall we pray?